The liver is not what I would consider to be a celebrity organ, but nonetheless, it's one of the most important organs in our body. You see, the liver is the body's factory. It takes in the nutrients that we consume through the food that we eat. It through that processes it into cellular building blocks, hormones, antibodies, enzymes, and other critical components of health and well-being. So taking care of it and having a healthy liver is important for a long and healthy life. There are 4 disorders fundamentally which can cause difficulty with the liver and can lead to liver failure or liver disease. First and foremost, the hepatitis viruses, hepatitis A, B, C, and the like, are very harmful to the liver. And so we're going to talk about those today. But there's also alcohol intake, which is excessive. Taking medications which are toxic to the liver, be they prescription medications, over-the-counter medications, or the herbals. All can cause toxicity to the liver, to poison the liver, and create liver failure. And then finally, obesity. So there's hepatitis infection, not good for the liver, alcohol ingestion, not good for the liver, medications which are toxic, and the new category, which is morbid obesity. All of those can lead to liver failure. So let's talk about hepatitis viruses that cause liver failure. First of all, there's hepatitis A. Hepatitis A is an acute infection, and it's acquired primarily through the ingestion of food contaminated with feces which contains the hepatitis A virus. So international travelers, especially to third world countries, are especially at risk. But so are persons who practice unsafe sex practices, who don't wash food carefully, who don't wash their hands carefully, are much more likely to get hepatitis A. The prevalence of hepatitis A in the United States is about 4,000 individuals. So unlike hepatitis B and hepatitis C, it's not all that common, but it's nonetheless is still an illness that can cause significant issues. There is, however, a vaccine, so that besides safe and healthy food and sex practices, you can prevent getting hepatitis A through the vaccine that's available. There is no chronic form, so most of the time people do not die from hepatitis A. Then there's hepatitis B. About 850,000 people in the United States are infected with hepatitis B. Hepatitis B has a chronic form that leads to liver failure and to death, so that preventing the acquisition of hepatitis B is critical. Hepatitis B is acquired through exposure to bodily fluids, blood, semen, mucus, and the like. So safe sex practices, careful hand washing, and avoiding exposure to the hepatitis B virus is really critical. There is a vaccine for hepatitis B, which is especially useful to prevent getting the doggone disease. So that it's a 3-part vaccine. We give it to newborns when they're during the newborn phase. The first 6 months they get 3 vaccinations, and then boosters during life. And if adults want to get the vaccine, they can too, to develop immunity and to prevent hepatitis B. Also need to point out that a pregnant mom infected with hepatitis B can spread it to her unborn child. So it's critical that pregnant mothers be tested for hepatitis B, and then the newborn carefully watch for the development of hepatitis B infection after birth. So that's hepatitis B, and remember, it can move into the chronic phase, and so getting it is not good because that's liver failure and death over time. Finally, there's hepatitis C. Hepatitis C is the big daddy when it comes to prevalence. There are like 3.5 to 4 million persons in the United States who have hepatitis C. Persons born between 1945 and 1965 are particularly at risk because we didn't test them for hepatitis C. We didn't know about hepatitis C during that time, and when they got blood transfusions, they were likely to acquire the virus, not know they had it, and now have a chronic form of hepatitis C. But also, it can be acquired through bodily fluids. So safe sex practice is important. Men who have sex with men must be especially careful. But exposure to bodily fluids, blood, mucus, semen, and the like, all ways that we can acquire hepatitis C, IV drug use, and the like. Transfusions. Also, just like hepatitis B, infants born to moms who were infected with hepatitis C can acquire the infection. So again, they need to be monitored carefully after birth for acquisition of the hepatitis C virus. There's no treatment, there's no vaccine for hepatitis C, but there is treatment. And the treatment is some new marvelous drugs, among them Harvoni, Mavorette, and Epclusa, that can actually cure hepatitis C. So the beauty of this all with hepatitis C is there's treatment for it and there's a cure for it, and that prevents the development of liver failure and liver cancer. So that's the cool thing about hepatitis C. This is Dr. Jim for Be Healthy, Be Happy. Power your path to happiness. Prevent liver failure and liver disease. Practice safe sexual practice, careful hand washing, avoid exposure to bodily fluids that may be contaminated, and by all means get vaccines when they are available to prevent these infections, hepatitis A and hepatitis B. And be sure to subscribe to Be Healthy, Be Happy with Dr. Jim on YouTube.